Hi there. My name is Tanya Smeets. I am a former midwife. I've been a midwife for 17 years. Lots of experience and lots of unschooling, especially in the last 5 years. And I want to make very short vlogs about exactly my experiences in these last 5 years, because they are very interesting due to the unschooling and due to working according to autonomy of the woman. I am 50 years old. I have 4 kids, almost all of them, 2 adults and 2 teens. Almost all of them adult, I was gonna say. And a husband, and I've been living in New Zealand, Australia, Ecuador, and now I'm living in Spain. I've been working in the Netherlands as a midwife. I was working according to protocol in the Netherlands in the time that I was working in the beginning, in the year 2000. The Netherlands still was an example worldwide of home birthing. And the midwives having a lot of autonomy in the Netherlands. A little bit like GPs, working like GPs, but then for birth. After a while, after 5 years or so, or 6 years of working, I moved with my family to New Zealand, and I've worked there as a midwife as well. New Zealand is a very physiological country, and a very similar system to the Netherlands. But I felt that they were actually taking a better route than the Netherlands was. So they were going into a better direction. When I came back in 2012, the situation had changed in the Netherlands. Fear had increased, and home births are on the decline, and very rapidly so. Lots of people are no longer home birthing. Before I moved to New Zealand, I was working in a practice where 80% of people birthed at home, that was above the norm. But nowadays it's extremely low. I don't know the exact figure, but it is very low now. I think it's somewhere under 20%. Why is that? Well, there was a lot of fear. That is what I noticed when I got back. I've always been trying to fight for physiology, which means the normalness of birth, trying to keep it normal, trying to keep it out of the sickness system, out of the health care medical system. And that caused a lot of fighting, a lot of struggle. In the Netherlands, I was fighting with obstetricians. In New Zealand, I was fighting with obstetricians. There's no difference. It doesn't matter where you are in the world. There's always the sort of patriarchal system against probably the female system. I don't know what the fight is about. But I was very tired of this fight. That is for sure. I was always trying to protect women, and I was burnt out, basically. So when I returned to the Netherlands, I didn't want to work as a midwife anymore, actually, and I was actually thinking of not working at all. But I found very quickly that this work, I couldn't escape it. It came to me. People were contacting me. They knew a midwife was living in town, and they knew that how I looked at things, apparently, very quickly. I don't know how this happened. I really don't. Because consciously I didn't want to work as a midwife, but very soon I was getting applications. So I had to think about how to work. How was I going to do it? Because I had a burnout and I didn't want a repeat of that. Well, in my opinion and in my experience, a burnout is caused by the fact that you are doing something that is not completely you. So I decided that I was going to do this time, I was going to do it in a way that was exactly me, without any compromise. Very interesting, very interesting. So I decided that I was going to work according to autonomy. because that was the one thing that I could see was lacking with the increasing medicalization. Women were getting less and less say in their births. And yes, there were lots of people with trauma, even PTSD, according and as a result of a birth. Lots of birth trauma. So I decided that I was going to do something with that, because that was where my heart was. That is what that is my passion. So I, for myself, worked that way, and I helped women to find out what they really wanted and to look at their own fears. Because the medical system can only be as powerful as it is because of our fears. That is the hook that they can draw us in on. So, are these fears justified? Is a question that you could ask. So I was reading a lot of material, lots of medical studies, and when I started working, I had enormously long antenatal clinic, like 2 hours per person, because I had to explain a lot. I decided that I was not going to make even one decision for anybody, which means that everybody needed to know what the normal procedures were and why they were there, what their advantage was, what their disadvantage was. Otherwise, they couldn't make a decision about it. So I, would start off with the blood test, for instance. Anything, it could be as simple as that. It could be as simple as an ultrasound scan. It could be as simple as blood pressure measurement. I would explain all the reasons for the fact that these things exist. I would also explain why there were antenatal clinics and what the checks, why there were checks. And I would explain the advantages, but also the disadvantages, because people seem to forget that as soon as you start investigating things and you find something, the big disadvantage is that you will have to make a choice about these things. If you have an ultrasound scan and you see something on the scan, a marker that could be linked to anything, like a syndrome or a disease of the baby, from that moment on, you will have to make a decision if you want to do further research. And these are hard decisions. And in 80% of cases, there is nothing wrong. So these things can sometimes ruin a person's pregnancy. And do you want that? Do you want to run that risk? So there were lots of things to explain. And yeah, it was a very nice way of working. I really enjoyed it. Of course, I did get into trouble quite quickly with local hospitals that were very afraid, because people that came to me wanted to birth in a way that they did not advise, that they found dangerous. And the fact that these women are grown-ups making their own decisions about their bodies is something the medical system is not used to. So and that counts for everywhere in the world. It doesn't mean that the Netherlands is any better in that, because it absolutely isn't. So there was a lot of talking. I did a lot of talking, and I even did some talks in front of groups of midwives or obstetricians. I did symposia, and at some point I even did a course together with 2 friends. I developed a course for midwives to work on their fears so that they could work autonomously. Yeah, it was a very interesting time, and I had and I learned so much from all the people that came to me, the clients, you could call them. I would almost call them friends. Some of them were very close friends for a while. Yeah, and I think that healthcare, it says that it's not professional, that your clients are your friends, but I think that it actually is one of the most important things, that when you give birth, there's someone next to you that you trust, and if there is a kind of friendship, I think that is wonderful. Yeah. So I don't think there's anything unprofessional with that. I think it is probably even one of the necessities for birth, for having a good birth. So yeah, so that was how I was working. I ran into trouble with hospitals, with colleagues, because they were very scared of what I was doing. And some colleagues, they had a practice. They would have somebody who had suddenly had developed a medical issue, or a dangerous issue, or something outside of protocols, and they would dump these people um, with me. They would just, even in the middle of the night, if somebody had ruptured membranes longer than 24 hours, they would say, tonight at 12 o'clock, it's 24 hours, we are not looking after you anymore. So if you want a birth at home, you'll have to go to Tanya. So I was going to be that kind of person, the person that you could go to in that situation. I found that very difficult. I found that lots of my colleagues were not attacking their own fears. They were not working on standing strong in themselves. They were not making their own decisions. They were handling. Yeah, they were living out of fear, and they were working out of fear for hospitals, for being punished. So yeah, so the situation was not ideal. And of course, there was the Health and Disability Commissioner. They came and checked my way of working, and I've been sort of on and off discussing with them for a few years. And they eventually decided that how the way I was working should be possible, and I should be able to do it the way I wanted to do it, because I wasn't doing anything ridiculous, without thinking, without knowledge, without experience. I was just following autonomy, and since that is a ground law, there wasn't a lot they could say about that. Even if that meant that I wasn't going to comply with certain things, because I wasn't. I wasn't complying with certain things they wanted me to do. The sad part is, of course, at some point they, even though they couldn't find a way to get rid of me, at some point something did happen, and there was a birth and a baby died. Yeah, most likely before it was born, but the cause is never found. But anyway, I was involved in that birth, and that was a disciplinary court, and my profession was taken away from me. So that is why I'm called a previous midwife, a former midwife, because I'm no longer a midwife. But I still want to give people, women, who are making choices for themselves, maybe differently from mainstream, and trying to stay outside of the medical system. I just want to give them some kind of support still. So I've been doing this in Dutch. I've been speaking in vlogs about subjects related to midwifery, and a very wide range of subjects, anything. So I'm going to try and translate them all in English, and in the hope of reaching more women, and maybe I can answer questions, I can support people over distance in this way. So if you have any questions, if you would like to know a different point of view about whatever, could be anything, could be an exam that you are supposed to have, could be a medicalization that you are supposed to undergo. It could be that you are more than 42 weeks pregnant and they want to induce you and you don't want to be induced. Could be anything. If you would like my opinion on it, yeah, just write me a question. I will write my email address under here, and I will try to answer it as honestly as I can. So you will hear more from me. Bye bye.